Welcome to Tree House Brigades at Baylor. We're brand new.
Yeah. Thank you for showing up tonight. The room is full. This is incredible. We started this. We were 4 of us from Baylor. My mother is the last one, so I don't think she really counts, but the 3 of us are here to do it again. So Global Brigades is a really, really big organization, but we are Tree House Brigades at Baylor. We are here to work in rural communities to help establish them, get them up and going, create sustainable impacts that can help improve their lives and for future generations. So Global Brigades is currently in Belize, Honduras, Panama, Nicaragua, and Ghana. Last year we went to Panama. This year we're going to Belize. And again, it's to create sustainable impacts and help people that otherwise wouldn't have access to the resources that we're providing.
That's my fault. I think I put people here. You're welcome.
All right. Cool. It's me. So when we go there, we're seeing on average about 500 patients. Some of these people are traveling 4 hours, and we'll end early in the day, 3 o'clock, something like that, way before sunset. And I know when we were there, we were like, well, why are we doing this? If we could go for longer, we could help our people. These people really are traveling 4+ hours to get to us. So we need to give them time to travel back safely during the day and whatnot. So they come to us because we help them significantly and they know we're going to be there. So we're reliable too. So to join our org, we're creating a friendly environment, a welcoming environment of people that want to create sustainable, significant change in these communities. And then we also grow together. I mean, the 3 of us I feel like siblings with you guys sometimes. And, my mom also, it gave me a great opportunity to get a lot closer with her because I've never seen her in a lot of those situations that we were in. And then it's fun. I mean, it's really fun. We have a lot of, we have a pretty good amount of downtime, and the stories that we tell, stories that we hear, I mean, it's a really great bonding experience for everybody, and we want to bring that to you guys.
So the model of Global Brigades is a sustainable one. So we don't just go out to these communities and just give them what they need and leave. It's kind of like the old saying, like, you give a man a fish, he'll eat for a day. You teach a man to fish, he'll eat forever. So we understand that we're only going for a week, but Global Brigades really tries to make a model to where those other 51 weeks out of the year, we're setting those communities up to be able to succeed in the future. So, for example, we have other brigades that aren't just focused on medical. So we have water brigades that help give these communities fresh water. We have like engineering brigades that help build roads. We have other economy brigades that actually help these communities create a farm almost to be able to grow their own food, be able to trade or sell these crops, and build a community that they'll be able to thrive in without us. So we're really trying to help them in the long run and not just be like, here's some medicine, get better. That's not what we're trying to do. We're really trying to help them as a community grow and be able to, function in a more modern-esque world. These are just kind of some of the statistics from when brigades started. That is 2005, when people started helping. And the different lines are like the different models of the brigade. So like this red one here is the medical brigade. And it just kind of shows how things have grown over the years and how we've been able to help impact these communities.
And this same chart can be applied to us. I mean, we were 4 last year, the 3 of us and my mom, and now we're hoping to get more than 20 people. And then the following year, who knows how many more. So, constant help and getting a lot of people to go.
Exponential growth.
Thank you. Exponential growth. And then this is crazy. Actually, I didn't know this until I made the slides, but they have 300 chapters from universities around the world. Most of them are in the US, but a lot of them are in Europe too. This is a short video on what to expect and kind of indulge you in what we're going to be doing when we go to Belize.
Just a broad overview of what you've seen in different countries, what they have done in different countries, and what we will continue to do. This is a very outward way to get an inside look.
Being able to work one-on-one with the doctors, they read to you the symptoms of the patient and what the patient's feeling, why and what medications they're receiving. And so that's what really motivated me to want to come out here and to help others. And just one small thing that we could do could make a difference to them.
Global Medical Brigades is an international movement of university students working alongside local communities and staff to implement sustainable health systems. We work in under-resourced communities that would otherwise have limited to no access to health care.
Aproximadamente 9 de cada 10 hondureños no están cubiertos por un seguro social, ni pueden pagar un médico privado o exámenes. También sucede de que las clínicas, por ejemplo, en la comunidad que nosotros estamos, actualmente el hospital más cercano está aproximadamente a 2 horas y media.
Muy contenta porque es muy bueno que hayan venido con tantas especialidades en el día de hoy, como lo que es medicina general, odontología. Muy importante, hoy trajeron fisioterapia, cardiología y pruebas rápidas, pues, que a veces las personas necesitan, pero por no contar a veces por transporte en lo que son personas mayores no pueden asistir a un centro de salud más cercano.
The lack of communication and how that's been a big issue, allowing people to have health care. And I think Global Brigades, with the amount of translators they do have, are making a big impact by allowing people to have their own autonomy and go to their own appointments and see doctors.
کلینیک به خاطری که مشکل داشتم اینجا آمدم به خاطر که ما ماجری مشکلات خیلی زیاد را دیدیم. اینا به حیث یعنی رایگان ما را تدریس میکنن و مشکلات ما را حل میکنن.
Being here for a week is a true immersion that by the end of the week, you know, you're speaking Spanish 10 times better than you were at the start. And I know we have so many people on our brigade who came in with absolutely no Spanish, you know, no skills, and they were still able to communicate incredibly effectively with, you know, members of the community, patients, and everything like that.
What started as passionate young adults wanting to make a difference turned into an empowering force of changemakers. We are the largest student-led movement for global health. We're collaborative, we're sustainable, and we're empowering.
For this brigade, we're having different stations, and I'm about to introduce you to each of them. So first, we're having intake, which is in charge of some people from the community, and we take the patient's ID number. After that, they walk with the runner to triage, in which we take their vitals, BP. After that, they get to the consultation. So depending on the symptoms and everything, they talk to the doctors. They will get referred to either PT, nutrition, or get a rapid test. And after that, they will go to Charla, and then finally, pharmacy to pick up their prescription by the doctor.
So when you come to Ghana, the last station that we have is the home visit. Home visit is designed in a way that our students go out to advertise the clinic that we are having.
And it was a great way to still get them the care that they deserve, but they weren't able to come into our clinic. So being able to go do their intake, have the doctors come to them, and then come back with their prescriptions at the end of the day or the next day was really something special, and I liked being able to be in the community actually making a difference.
I'm here for medical treatment, and I like how they are treating us very well. As for me, I'm sick. They have given me a lot of medicines for me to go and take it at home.
In addition to sustainable access to health and dental care, our work empowers under-resourced communities with clean water and public health infrastructure, unique to each country and community. We want to make an even bigger impact, and we want you to join us.
I'm telling you, I'm challenging you, make an impact, come and work and empower communities.
So that's a little bit about Global Brigades as a whole. They mentioned it in the video. We have intake, triage, consultations, educational workshops, aka Charla, and possibly vision stations, for sure, pharmacy station, and then at the end of the day, there's data processing, where they take the information from intake all the way to pharmacy to see what is being given out and what the clinical portion of the brigade is happening because on the first or last day, loose itinerary is whenever you go out and research, do your survey research, and you ask the community members, like, what are they eating every day? What does a meal look like? What toys do you play with asking kids? When do you begin breastfeeding? When do you stop breastfeeding? Things that we think are trivial to everyday life, they don't have access to that as well as we do, and that is the point of Global Brigades, because we take all that information, we give it to Global Brigades, and then they send out what you saw was like infrastructure, public health, and engineers or STEM brigades. Yeah, this is a sample itinerary of what the week would look like. Everything is very loosely, it's a very loose timeline, honestly. We had a lot more downtime than we thought we would have to be able to just explore the resort we were at and just connect with the people that also volunteered through Panama to talk with them and just see what it was like with them. And I mean, other than that, I mean, the first and last day is just your breakfast, you leave to the airport, or you get picked up from the airport. It's very stress-free. It's not like this, and this. You have the ability to breathe. You're not constantly.
Yeah, like even though we were there to do, like volunteer and medical parents and whatnot, part of it almost felt like a vacation because we had so much free time. We got to do a lot of exploring around, the area or whatever. So it was very enjoyable. I'm not going to preach something to go send people off and be miserable for a week and, work nonstop to make a difference. And we really enjoyed our time there, and that's why we're trying so hard to get people to go with us again.
So this year we're going to Belize, as we've mentioned several times. But what we really want to hear from you guys, is fundraising ideas. I mean, we know this trip isn't cheap for everyone, but we really want people to be able to go on this trip because we really value this trip and we thought it was a great experience, very eye-opening. So throughout next semester and hopefully next year we'll be able to start sooner. Obviously, we just got chartered this semester. But we really want to brainstorm ideas on how to come up with fundraising to be able to get the cost of this trip low as possible, so that as many people can come on it as possible, and just kind of grow the program. And we think that should be a communal thing, so that the program really heads in the right direction.
Yeah, and then if you guys have any ideas, DM us. We'd love to hear it. And then part of our plans is also to do some collabs with other orgs. Maybe if they're having some fundraising events, whatever, just get the word out about us, spread to their members, and go from there.
So now you finally get to meet us.
So my name is Tyler Selkin. I'm a senior health science studies major on the pre-med track. A fun fact about me is that I am half Czech and I speak Czech somewhat decently. It's not as good as my Spanish, but I can still get around.
My name is Ashleigh Rey-Cook, and I'm the vice president. I'm a junior health science studies major and on the pre-med track, and I am originally from South Padre Island, Texas. Fun fact about me is that I have been to more countries than I have states in America.
I am Connor Grudt. I'm the treasurer. I'm a junior here, biochemistry major on the pre-med track. I'm from Huntington Beach, California, Orange County for more people. And fun fact about me is I play lacrosse for Baylor.
So these are some positions that we need you guys to fill. We can't do this on our own, we can start it, but we want you guys to be involved. The 3 positions that we're opening up is historian, fundraising chair, and public relations. A little bit about each of them brief is historian is going to be the main person taking pictures when we go on this trip to then be able to then advertise this trip in the future, and people can actually see like what we're doing. it's not just, oh, here's what I'm doing, talking about it. It's, I get to see it, because for most people it's seeing is believing. And they'll work hand in hand with the fundraising chair, because they will also take pictures and things of that nature while we fundraise to promote those things. Fundraising chair, and the name itself, reaching out to the community, seeing who is able to sponsor us, support us, and be able to interconnect. You'll work a lot with the vice president, me, at the moment, to get outreach programs in place or anything like that. And then lastly, our public relations is different from social chair. In our case, because we don't have a social chair necessarily because we don't have meetings. We don't have events that are necessarily going on, and if we do, president or vice president will do that, and they will be taking care of the Instagram and social media side. So again, these all work together.
So these are some of the thousands of photos we took in Panama. I don't know, do you remember how many photos we had in that album?
10,000 pictures.
Yeah, it was about 10,000 pictures. So these are just some of the general photos. So here, let me see if I can see pictures. It's hard to see up close. Okay, so this was dental station. So this is an actual extraction that was going on. So you could work and participate in those extractions. Here, this girl, we love this girl. She loves taking pictures with all of us. There was probably 100 photos with just her going around taking us and making her take pictures with us. This is one of our friends from UNLV that went with us. You'll see plenty of babies. This was actually on the resort, basically the place where we stayed. That's on the property. This was before we actually went out into the communities, and that was just kind of our organization day. That was when we organized all the pharmaceuticals, all the supplies that we were going to take. Fix that. Just more pictures out in the community. This was our whole team. These are their doctors, pharmacists, and our dentists. More pictures. Same girls. This was another one of the dentist stations. That was actually, we were giving fluoride treatments to the kids. Probably the only fluoride treatment that they get all year or years, depending if they come back.
But yeah, one more thing I want to point out on this slide, that middle picture on the bottom, there are 21 of us. There's 3 doctors, well, 2 doctors, a dentist, and a pharmacist, and 20-ish volunteers. And we helped 250 families in three clinic days and a research day. So the more people we get, the more significant impact we have. And I mean, we want to help these people. So come with us, bring a smile. I mean, just think, let's get going.
And I know Tyler mentioned this earlier that a lot of these people will travel 4 hours. This isn't 4 hours by car. This is 4 hours walking. So a lot of these people will get up at like 4 in the morning, start their hike in the mountains to come see us. So they really do need our help because we're really the only doctors that they'll see for an entire year. Yeah.
They do really want to help.
This is another important thing for money aspect. So some of these like certifications, so like EMT, nursing assistant, registered nurse, you get a scholarship if you have one of those certifications. Obviously, we know people aren't probably going to be doctors or a PA at this point, but just so you know that there are scholarship opportunities. I believe it's a $400 scholarship if you have one of these, but just throw those out there. And then obviously, if you know other people that want to come on the trip, mom, that's a nurse, your dad, that's a doctor, whoever, fight them. Like, go for it.
Jeez. And then right now, the donation goal is sitting at $24.20. This number might fluctuate a little bit, but we think it's going to stay right here. This includes flights, insurance, ground transportation, housing, meals. I mean, literally everything. $24.20. I believe if we get over 39 people. It drops a little bit. Don't quote me on that. We can get numbers, but we also don't expect to go over 39 with just Baylor. And then there is a down deposit that you'll put down in late March or early April. I believe it's 150 or 250. 150. 150. But again, that's not until March or April. We'll have another meeting before then about specifics. We're just trying to get people to want to come on this trip with us. And then this is more on what I said last time. It's travel, insurance, food, lodging. It's helping with the year-round stuff. Because again, we're there for a week, but the people are there all year round. And then Global Brigades also does have permanent staff that they have to pay, so some of this is going to that. And then I'm not going to read this stuff, but in the future, if we like Belize and want to go back, that's great. But if we want to try somewhere else, we can go to those other countries that I listed at the beginning. There's more information on these if you'd like to check it out. Here's a couple links if you want more information from Global Brigades. Again, we're going to have more meetings on stuff. If you have questions, get a hold of us. We're open books about our experiences, and if we can't answer something, we'll go seek out those answers. Special shout out to Macy Perkes, who helped put this presentation together. She runs UNLV's medical brigades. And then these are the positions that need to be filled. If you're interested in applying for those, scan QR code. There's a description at the beginning of the form. And then you'll have to answer a couple questions, but it's not difficult.
It's like 3 questions.
Yeah, 3 questions, real short. I think that's it. All right, thank you guys for coming. Full crowd. We'll see you guys at the next meeting, which is going to be way.
Email us questions if you have questions for those who are watching. Bye.